At the outset, I would like to thank the organizers for giving me this opportunity. And I also want to assure the audience that I'll not be standing between you and lunch. Everybody would like to speak, including myself. I'm coming from the teaching background. Uh, the other assurance from me is I've got a very small presentation of 11 slides. If you take the introduction and the last slide, it's 9 slides. When I was asked to do this lecture, I was a little bit apprehensive, though I had an extensive experience of about 30 years in the medical and dental profession. I have started my career in government dental college and hospital in doing my graduation and post-graduation, and I have an extensive experience working in the government sector. And I was also selected for a government job, and then I worked in the district hospitals. And later on, and only about 23% of the hospitals are actually there, and they are probably ill-equipped or are having low manpower. So, what are the challenges which the health sector is facing? The important thing is the regulatory framework, and a lot of things have to be desired. It is not a robust system. For example, when you take a insurance coverage, there are always, pre-existing disease conditions cannot be covered or things like that. A lot of things are there where you can actually improve the health system. And though, people look at differently, the private people are there, they are providing good service, but they have a job to do. They have to have a return on their investment for their investors and for them also to be financially viable, and because it's a business model. And the other, is most of the hospitals are actually concentrated in the cities, and we can, there is still a lot of penetration is not there in the other cities or even in the rural areas. And again, infrastructure and quality standards are not uniform. Maybe the top hospitals or even government sector, maybe hospitals like AIIMS or even in the private sector, only top 2 to 5% are actually maintaining the infrastructure standards or the quality standards. And there is no uniform regulation where you are actually controlling these hospitals. And what is happening is actually the disease burden is actually increasing. In spite of all the digital age, we are not taking care of ourselves. Both the communicable diseases and non-communicable diseases, both are actually on the increase. What are the solutions which we can do? A lot of thinking has to happen, and unfortunately it happens from the government side. Mostly it's bureaucrats probably trying to formulate, and regulatory reforms are always needed, and trying, especially in the insurance sector, and increasing access and affordable health insurance. I was recently listening to a lecture by Devi Shetty in AIIMS on a telemedicine lecture. How can we make it affordable for everybody? So the he has come out with a figure like, for a family of 2 or 3 or 4, 8,000 to 10,000 family package insurance can be easily be affordable, and it will cover multiple hospital visits and a 10 lakh insurance coverage and a 50 lakh maximum cap limit if they are having something very serious issue. So this is something which we need to look into, and this is for the bigger players to look into this as to how we can expand the scope. And again, training and skilling. Every hospital which runs, I think there is a high attrition rate. So we need trained manpower, especially doctors, nurses, and India is doing great in trying to increase the government is doing it, Telangana government is doing it. So there is going to be increased skilled manpower, but they have to match up the standards, which again is a challenge. And a neglected area, which personally I see, is most of us, we are treatment oriented. As somebody has said in the morning, we are more hospital oriented. What is lacking is where the patient can connect with his GP. Okay, the GP should be the first point of contact rather than a hospital or something else in a surrounding which is maybe where accessible around the corner. I think a very attractive term, I may not be watching for it, something like a Mohalla clinic or a PHC center in the government sector, or I think the corporates can actually take this forward so that the patient actually connects with the GP better than in a hospital environment. So we have to see how the patient can actually get comfortable with his doctor, and not always he may actually be requiring treatment. And we have talked and seen a lot of health tech and AI-based services which are there. And India is a huge country, and most of the time we are adopting technology or AI based or something. We need to invest in our own AI based things. And I was glad to know that KIMS is already doing something like that. And this is what is the need for our is we have to create data, we have to create solutions for our own population. And the thinkers are actually saying that we are going to become a trillion trillion economy pretty soon in 2025, and maybe more by the time we reach. That's what is the outlook. And India is the place where we are going to set standards, and we are going to set goalposts for the other countries to follow. And coming back to our institution, we are a large health ecosystem. As I said, we have training institutes for 2 medical colleges. We have 2 exclusive dental colleges for women. And recently, we have set up a allied health sciences in our campus, which is giving a 4-degree course and covering the whole spectrum of allied health sciences, from all the technicians to whatever. It's a comprehensive 4-year degree course. We are not only trying to, I think this is a happening thing, and we are also trying to equip and train them so that they are on par with the people with the rest of the country, and maybe they can look at opportunities abroad as well. And with technology wise and manpower wise, we are seeing that they get the best. The other thing, what I have seen as a clinician or as a teacher, is I think a lot can be done, especially if private hospitals can actually mentor some hospitals. They can take up some government hospitals or institutes, because they are doing pretty extraordinary work in specialty areas which may be missing in some government hospital or in a medical college. So this this guiding or mentoring system will always help the evolving health ecosystem. And I always feel proud that I'm a good professional, but where I'm actually doing bad is in the business aspect of it. So the doctors should also know a little bit of a business, and the business managers should know a lot about doctoring. So the doctors should become a little bit of managers, and managers should become a little bit of doctors. So this will help the health ecosystem in a great way. I'm excited when I look at the tech scenario, and as I was preparing for this, what I am told is we are hearing a lot about Chat GPT, which is a general GPT. And what Microsoft is doing is actually it is partnering with healthcare providers and coming up with a Bio GPT, which probably will give you a outpatient-based services. It may replace, a lot of people will think that it may replace, but India, as you will know, that we are going to be the most largest populous country by 2030. And we have the most youngest population, 1.7 or whatever, the most youngest population under the age of 35. So we have a huge scope. We don't have to worry that something will replace something. So AI is going to here to stay, and it can integrate and us better, so that all our deliverables and outcomes, as we have seen, are going to be better. And a good thing which I've actually picked from Guy Kawasaki, who I think most of you would know that he worked for Apple, and he used to lead this marketing solution. What most of us do, we are very short-sighted in our approach. We are trying to compete in the same crowded market. What we need to do is get out of the market and expand our scope, whether we are trying to increase the insurance coverage. And a neglected area is screening and prevention, as the ma'am told in the beginning of the lecture today. Screening is prevention. Actually, it's not glorified, but I feel it is at the top of the pyramid. It will go a long way, and actually in building a rapport and building the patient-doctor relationship, or the hospital-doctor-patient relationship. And as one of the audience doctors has pointed out, the challenge is always making it affordable. And then as technology or anything is embraced on a larger group, then obviously it will become affordable. So there are various ways which we can, and we have to be part of the solution rather than trying to be part of the problem. And medical tourism is again, which most of the hospitals are already doing it. So it's for the other people to actually embrace it. And since I am from the academic background, what single solution which everybody in the industry needs to do is to incorporate research. Okay, research is the single, and COVID has been a big example. Probably hundreds and thousands of doctors have actually worked day and night trying to deliver the services for COVID, and a single vaccine actually has changed the entire scenario. So there may be a new drug which can actually be a magic pill, as my some colleague has said. So these are the things which can actually cause a disruption in the technology, and we have to see that as hospitals we have a huge database of patients, whether it is electronic or physical or whatever, and we can actually be part of the ongoing enhancement in delivering better patient outcomes. And one thing which I miss is whenever I'm looking at the social media, it's mostly not the qualified people actually delivering, whether it is on nutrition, whether it's on keto diet, or whether it's in cardiac or whatever. So all the hospitals actually should have dedicated educational units where you deliver, authentic evidence-based outcomes for the patients, which should be easily available at the click of the button, and hope probably all this will be integrated by ChatGPT. And CSR activity, I think, is one thing which is core, and then we as doctors always keep doing it, and it will actually earn you a lot of goodwill and blessings as well from the patient. So my take-home message is actually whenever a patient is sitting in the front of me, I actually put myself in the patient's shoes, and then I try to walk with the patient. So this will go a long way. And as my colleague, I acknowledge the presence of my CEO, Mr. Mahendra Pala, who's been supportive for me to deliver this lecture, and he's been part of the Empathy Project. So this is one thing which is in the age of digital age, we are missing this. So this should be a core of everybody's professional, not only the professional, everybody in the hospital industry, this should be at the core so that, we have a happy patient in the end. And I acknowledgements to my director, Dr. Ramana Reddy, and acknowledgements to my CEO who have been supportive for me to deliver this project. Thank you very much for giving me this opportunity.